All right. Okay, so I'm Grace, and I'm here with Kieran.
Hello, I'm Kieran.
And we are first-year medical students at Georgetown, and we are here through a community-based learning program in partnership with St. Martin's to talk about the COVID-19 and flu vaccines today. And we also just wanted to mention that some of our classmates who are here with us as well will be presenting in the upcoming weeks. All right. Okay, so first of all, we just wanted to say thank you to the St. Martin's community, Father Kelly, Miss Fairfax, Dr. Casarineni, for giving us this opportunity. And we are so excited to spend some time with you all through these presentations and at the health fair. And we just wanted to outline the presentation. So we'll be giving some general definitions and background information related to COVID-19. We'll talk about the what, who, how, and where of COVID-19 vaccines and next steps for the COVID vaccine, as well as the flu and flu vaccines. And then we'll open it up in case anyone has any questions or wants to share anything with the group. Before we get started, we also just wanted to mention that public health guidelines are based on studies and scientific evidence, but never absolute certainty, and that most of the information in these slides was obtained from the CDC, or Center for Disease Control, and studies on COVID-19. We will also be including some videos in this presentation and would love input from the other people on the Zoom. All right. Okay, so what is a virus? Basically, a virus is a type of germ that can spread from person to person. It can enter and infect a host or a person, replicate and spread to other people. Some examples of viruses, the common cold and flu are both viruses, as well as hepatitis, HIV, chickenpox, and COVID-19. And just one thing to mention, viruses are different from bacteria, so we can't treat viruses with antibiotics. And all viruses change or mutate over time. So the more cases and infections can lead to more mutations and variants. These changes can change how the virus is spread and what we can do to prevent getting it. And we'll talk a little bit more about variants and the Delta variant later. All right, so what is COVID-19? COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. It's also known as the coronavirus, COVID, the novel coronavirus. And we learned of COVID in late 2019 and early 2020. And I think it's safe to say that COVID has impacted all of our lives. The world has documented over 219 million COVID cases. And in the United States, we have lost over 673,000 lives to COVID-19, and that's actually being represented and memorialized by the Washington monument by the white flags right now. All right, so some information about these symptoms and spread of COVID-19. So COVID-19 is essentially spread through breathing and things that come out of your mouth and nose. So like breathing without a mask, coughing, sneezing, and close contact with people who have COVID-19 infection. The symptoms of COVID-19 vary. Some common symptoms include tiredness, body aches, cough, shortness of breath, loss of taste and smell, and more. Some people might just feel a little nauseous. Some people are completely asymptomatic. And even the people who are asymptomatic can spread COVID to others. Right, and here's just a short video about variants.
Ways. So what do scientists mean when they talk about variants? And what might this mean for the future of the pandemic? Viruses multiply by copying their genomes over and over. But like an old photocopier, these copies aren't always perfect. Each of these imperfect copies is a variant. Normally, the imperfections or mutations don't change how the virus behaves, and they can often make it less successful than the original strain. But very rarely, mutations can change the virus in some important ways. It could become more infectious or more able to avoid the immune system. The more a virus is allowed to replicate unchecked, the more chance it has to accumulate these rare beneficial mutations. That can occur when viruses are allowed to spread quickly through a population, or if they encounter a host that's less able to fight them, such as people with compromised immune systems from medical treatment, or those who are HIV positive. If a particular set of mutations makes a variant more successful, it might become more prominent than others, and that's when it gets noticed. Ways.
Right, so that brings us to the COVID-19 Delta variant. The Delta variant is a form of COVID-19 that accounts for most current United States COVID cases. The first case of the Delta variant in the United States was identified in March of 2021. And Delta cases started to kind of spike this summer. And the Delta variant seems to, I'm sorry, one second. All right, sorry about that. The Delta variant seems to spread faster and cause more severe illness in people. So it's most likely responsible for the uptick in cases and hospitalizations we've seen, including those in children and young adults. Vaccines are still very effective against the Delta variant. We do see cases or breakthrough cases, which we'll talk about a bit later, but vaccinated people are less likely to get and spread the Delta variant. And some ways to avoid the COVID-19 Delta variant include vaccinations and masks. All right, so vaccines provide protections from infectious disease by teaching our bodies to make antibodies against the disease. Vaccines are typically given in the form of shots, and people often get vaccines as children, as well as the annual flu vaccines. One thing to mention, vaccines are not new. Okay, the first vaccine was developed in 1796 for smallpox. And we've seen vaccines successfully eliminate some diseases that used to be common, like polio, smallpox, tetanus, chickenpox, and more. So we have established that vaccines are effective. And we'll send it over to Kieran for the information on the COVID-19 vaccine.
Yeah, so what is the COVID-19 vaccine? Oh, wait, am I? Okay, so the COVID-19 vaccine was first administered in December of 2020, so it's been around for almost a year now. And the US vaccines include Johnson & Johnson, Pfizer, and Moderna. And the Pfizer vaccine has full FDA approval, whereas the other two are approved for emergency use. And the Johnson & Johnson vaccine is like your typical vaccine that you would see with a flu shot, whereas the Pfizer and Moderna use the mRNA technology. And all three of these COVID-19 vaccines are safe, and all three are effective against the Delta variant. Okay, so we've included a little video here about the mRNA vaccine, since we know this can be kind of a confusing topic.
mRNA vaccines have been in development for 20 years and are now approved to prevent COVID-19. Unlike some other types of vaccines, mRNA vaccines do not contain any pieces of the virus. Instead, the COVID-19 mRNA vaccine teaches our own cells to make the quote-unquote spike protein found on the surface of the coronavirus, triggering an immune response. In short, they help our bodies produce antibodies specific to the virus, along with T cells that also confer immunity. That sounds great, right? But I bet you're thinking, how exactly does this work? Well, it works by simply reproducing the same immune response that happens in a natural infection, but without actually infecting your body. Cool, right? Still, there are some common misconceptions about this vaccine. So let's break them down. Number one, this type of vaccine is new, but it's not unknown. Research and development of these vaccines have gone on for decades before this pandemic. Number two, these vaccines do not affect or interact with your DNA, and the mRNA never actually enters the nucleus of the cell. Number three, while the vaccine does have some side effects like the potential for fever and soreness, they do not infect your body with the coronavirus. Side effects after vaccination are not uncommon. Number four, yes, if you have recovered from COVID-19, you should still consider a vaccine. We still don't know how long immunity to the virus lasts. Number five, vaccination along with face masks, social distancing, and hand washing is key to resume social gatherings and reopen the economy. Got more vaccine-related questions? Leave them in the comments.
Okay.
mRNA vaccines have been
Okay, so why should we get the COVID-19 vaccine? Would anyone like to share maybe why they received the vaccine or why they think it's important?
I guess I can talk here. I received the vaccine because I wanted to protect my family and I wanted to protect myself from getting the vaccine. And I have a 3.5-year-old daughter, and I'm looking forward to when she might be able to get a vaccine as well, because I'm worried about her since she doesn't have the vaccine right now either. And she's going to school, and of course they have safety precautions there, but that's not, as far as I understand, not as good of a protection as getting the vaccine. So.
Okay, yeah, thank you. So as you mentioned, it's really important to protect those who can't be vaccinated, such as children, and getting vaccinated helps to prevent you from spreading the virus. It helps to slow the development of new variants, and it prevents our healthcare system from being overwhelmed. So even though vaccinated people have become infected, the infections are typically more mild and they don't spread to others. Okay, and this is just showing what happens when people are vaccinated. The virus really doesn't have anywhere to spread to, and this helps to keep the community safe. Okay, so who can get the COVID-19 vaccine? Anyone who's 12 years and older can get it, and children who are younger should hopefully be able to get it in the fall and into the winter. Also, people who are pregnant, breastfeeding, or thinking of getting pregnant should all be vaccinated. There's no complications from the COVID-19 vaccine with pregnancy, and the vaccine helps to protect both the mother and the baby from the virus. Also, people who have cancer and are receiving either chemotherapy or immunotherapy should be vaccinated, and they should discuss with their doctor about receiving a booster shot since they are most likely immunocompromised. And we'll discuss the topic of booster shots later on. Okay, so who has been vaccinated against COVID-19? So far, 101 million Americans are fully vaccinated. That's about 55% of the total US population. And 417,000 DC residents are now fully vaccinated, which is about 60% of DC residents. Okay, so who cannot be vaccinated? As we've discussed, children under 12. However, again, they're currently doing research on this, and hopefully children will be able to be vaccinated come the fall and into the winter, depending on their age bracket. And people with allergies, if you have an allergy to an egg, preservative, or latex, you can be vaccinated. The vaccines don't contain any of these ingredients. And then those who are allergic to polyethylene glycol, should only receive Johnson & Johnson, and those allergic to polysorbate should only receive the mRNA vaccine. Okay, so what can you expect when getting the COVID-19 vaccine? Would anyone be willing to maybe share their own vaccine experience and maybe what symptoms they had and how they found the whole experience to be?
Yes, good morning. This is Charlene. I received both shots of Moderna about a month apart in February of 2021 and then in March of 2021. With the first shot, I experienced a little bit of local soreness in the arm, which lasted for, I guess, less than 24 hours and actually nothing else. When I went for the second shot, it was given in the same arm, actually by the same pharmacist at Giant. And that time I felt nothing. I had no symptoms of any sort. And that seemed to have been the same for most of the folks that I know that had received either the Pfizer or the Moderna vaccination. Very few people reported having any type of soreness, redness, anything after 24 to 48 hours after the shot. So it's safe to do, and I encourage everyone to get their vaccine. And I'm looking forward to getting my booster as soon as it's available to me.
Okay, yes, so thank you, yeah. This, as you mentioned, the side effects are typically not too bad and they resolve within a day or two. You can get vaccinated at your local CVS, a doctor's office, a hospital, or a vaccine clinic. And the vaccine's completely free whether you have healthcare or not. And a couple things to note, when you receive your vaccine card, make sure you keep this safe and take a photograph of it in case you lose it. And if you receive either the Moderna or the Pfizer, you will need a second shot, and they will schedule this for you after you receive your first vaccine. Okay, so these are just a few vaccine locations near St. Martin's. You can pause the video here, and you can call any one of these numbers to make a vaccine appointment. And we've also broken down which pharmacies offer which vaccines in case you have a preference.
All right, so some next steps for the COVID-19 vaccines. I think we touched on a few of these earlier. But so something we're seeing right now is third doses and booster shots, and we'll talk a little bit more about these. They are similar, but not quite the same. We're also looking at COVID-19 vaccines for children under 12, as well as a possible Delta targeted vaccine. And as we're moving forward, we should be expecting vaccine requirements at some places of employment and schools, as well as proof of vaccination for entering certain businesses, events, restaurants, and other social settings. All right, so third doses and boosters. These are for the mRNA vaccines. So that's the Moderna and Pfizer vaccines. People who are immunocompromised are currently able to receive a third dose of the COVID vaccine. And this is because people who are immunocompromised do not build the same level of immunity or antibodies following the 2 doses of mRNA vaccine as non-immunocompromised people. So the term or the category of immunocompromised includes people receiving cancer treatment, people taking immunosuppressant medications, or people with specific diseases affecting the immune system. If you think you might fall into any of these categories, you may want to talk to your doctor and ask if you're considered immunocompromised and may benefit from an additional dose of one of the mRNA vaccines. As of right now, over 1.92 million people in the United States have already received a third dose of the vaccines. So for booster shots, on Friday, the FDA announced that they are recommending booster doses for fully vaccinated people over 65 who have received 2 doses of the mRNA vaccine. And we should have more information about actually getting these over 65 boosters in the coming week or two, assuming that the other agencies agree with the FDA. There's also a possibility of a booster shot for people who received the COVID vaccines soon after they became available, like essential workers or healthcare workers. But boosters for healthcare workers and the general public under 65 are not recommended at this time. Okay, so a third dose is just a third dose to get immunocompromised people to the same or similar, hopefully, level of antibodies as non-immunocompromised people, while a booster is based on the concept that that these antibodies or immunity might dissipate or go down over time. So there's more kind of distance or months between the booster and the original vaccine than the third dose necessarily. Okay, so kids' COVID vaccines. Pfizer is currently doing clinical trials for the COVID vaccine in children and has plans to submit the data for the 5 to 11-year-old age group for authorization from the FDA in September, which is now, of course, to October of this year. So we should expect to hear the results of the 5 to 11 age group soon and possibly have a vaccine available for that group in October or November. And the younger kids would be following shortly for that. These vaccines would still be a 2-dose schedule and they'd be 21 days apart because the Pfizer vaccine is given 21 days apart. And we've also included a link in this presentation for registering your child or pre-registering your child for DC COVID vaccines. Okay. All right, so what to do if you are fully vaccinated? The current recommendations for fully vaccinated people are to continue to wear a mask in public, especially in small like indoor spaces or just places where a lot of people go, like grocery stores and public transport. After getting vaccinated, you're considered to have the maximum protection after 14 days. So that's 14 days after your second mRNA dose or 14 days after the single Johnson & Johnson vaccine. And we do recommend, or it is recommended, of course, to take a picture and save your vaccine card and to continue to be cautious about COVID-19, even if vaccinated. And a big part of that, those precautions are because of breakthrough cases. So a breakthrough case is when a fully vaccinated person tests positive for COVID-19. And the risk of catching COVID-19, even the Delta variant, is seen to be much lower in vaccinated people compared to non-vaccinated people. Despite getting a lot of media attention, breakthrough cases are still rare. For example, in DC, less than 1% of COVID cases are in fully vaccinated people. So unvaccinated people are still making up the vast majority of COVID cases. And regardless of vaccination status, it is recommended to get tested 3 to 5 days after an exposure if you come into contact with someone who tests positive for COVID-19. So if you're in contact with a COVID positive person, they recommend getting tested even if you're fully vaccinated.
Okay. So we'd also like to talk about the flu vaccine since flu season is here, and it's also very important to be vaccinated against the flu. Okay, so what is the flu? The flu is just a contagious illness caused by the influenza virus. Depending on the person, it can cause mild to severe illness, and in some extreme cases, it can even cause death. So common symptoms include feeling feverish, cough, sore throat, a runny or stuffy nose, and then body aches and fatigue. And people who are over 65, pregnant people, and children younger than 5 have the greatest health risk. So if you fall into one of these categories, it's recommended that you receive the vaccination as soon as possible. Okay, so what is the flu vaccine, and why is there a new one every year? So depending on the year, different flu viruses are in circulation. Scientists then monitor which viruses are the most prevalent, and they make predictions about what's most likely to occur in the coming flu season. The World Health Organization then uses these predictions and makes recommendations for which viruses the vaccine should target. Then in the US, the FDA makes the final decision on which viruses they're going to include in the US vaccines. So ultimately, 4 viruses are selected. And based on how accurate the predictions are and which viruses are included, the effectiveness of the vaccine can really vary. So some years it provides greater protection than others. But regardless, the CDC still recommends that everyone receives the vaccine, since there's really no way to know how effective it's going to be until after flu season. Okay, so why should we get the flu shot? Right now, there are already cases of this year's flu variant in Washington, D.C., and this is earlier than it usually is. And getting the shot will protect yourself and prevent serious illness, and it also protects those around you who are not vaccinated or maybe cannot receive the vaccine. And it's important to note that you cannot get the flu from the vaccine. Okay, so where and when can we get the flu vaccine? It's actually available right now. You can get it tomorrow if you go, and you can get it at your local doctor's office or a local CVS pharmacy, and you don't need an appointment. You can make one if you want. You can go online or call ahead, but you can also just walk in. And many of these places also offer the COVID-19 vaccine, so you're able to receive both vaccines at the same appointment if you're not already vaccinated. And there's no health risks with doing this. Okay, so we just wanted to open this up. Before we get to questions and community discussion, though, we were just going to show how to make a vaccine appointment through CVS. Okay, so if you go to the CVS website and click on COVID-19 resources, and then go down to COVID-19 vaccines, you'll hit schedule a COVID-19 vaccine, and then just hit no and no. Okay, so say you need an extra dose if you're immunocompromised or above 65, you'd hit this. And then here you can see that you can add a flu shot. Okay, so you just put in your birthday and then pick your type of vaccine. Put in your zip code. Okay, and then here you can see all the available times. So you would just select whatever works for you, and then you would put in your information and go from there. So it's just a quick walkthrough. But yeah, I'll stop sharing my screen now, and then if we want, we can open it up for discussion.
All right, so would anyone else like to share their experience with getting the COVID-19 vaccine or the flu shot?
Sure, I went in and got my the Pfizer vaccine shot. It was in, I believe, late April, and then the second shot was sometime in May. Went over to Anacostia, and they gave me Pfizer, and I had soreness in my arm, and I think I felt pretty sluggish the next day after the first shot, but then that went away quickly, and then the second shot, absolutely no reaction whatsoever. And I think my wife, she got the Johnson & Johnson shot, and I think she felt sick for about 24 hours afterwards. Maybe after 6 hours, then it started coming on, and then she felt sick. for about 24 hours, and then it went away, and she was fine. So yeah, it was there was a little bit of pain there, but not very much, and well worth getting the vaccines and the peace of mind.
Thank you so much. Yeah, I was in somewhat of a similar situation as your wife, in that I did feel somewhat achy following my second dose for about 24 hours. But it went away, and I am very glad that I got the vaccine. All right, anything that anyone would like to add or ask? I know that you mentioned kids vaccines coming up, or booster shots, anything like that.
So for the kids, obviously 3.5-year-olds.
Right, that's less
see
than
that's,
5, yeah.
that's 2 to 5 range. You said that it would come soon after the above 5 years old. Do we have an idea? Like, is it going to be a month? Is it going to be 2 months or weeks or what?
Right. Yeah, so it's hard to say exactly what that time interval would be. It looks like they are kind of, once we have the info, we'll get a little bit rolling on that. I would say that we should expect to have them before the end of this year. Exactly when that will be, hopefully by like November. Yeah, we're all just kind of, waiting for the announcements on those. But once they release the 5 to 11, it should be pretty quick after that.
And can you speak more to the process for getting to the point of saying that having the emergency authorization to get the vaccine?
Yeah, absolutely. I can share a little bit, and the healthcare experts, the doctors and pharmacists in our group, I invite them to add or correct me if I falter on this. But from my understanding is that how they do these vaccines, both for children and adults, is through like randomized controlled trials. So you get a group together of for this, we'll just say like 5 to 11-year-olds, and you give like half or a specified amount, like a placebo, which would be maybe a saline or just empty essentially shot, and then you give the other half the COVID-19 vaccine, and you kind of look for differences in terms of are some getting COVID or some not. Are there any, are we looking at any side effects or complications in any of these groups? And we test or we take certain like measurements. That could be antibody levels, that could be positive tests, that could be symptoms. I think they're looking at all of those things, and we compare them, and they present the information to the FDA and CDC. And what they'd be asking for right now is the emergency use authorization, which means, obviously, not obviously, I'm sorry, COVID-19, as we've seen it, has changed all of our lives. And, there's been, like I said, over 219 million cases and over 673,000 deaths in the United States. So if anything is an emergency, it's COVID-19. But that would basically get the COVID-19 vaccine authorized to distribute to that age group. And yeah, am I missing anything, or could you add anything?
No, I think Grace and Karen did a fantastic job, like detailing everything. And even to this question, I think it's right on. To my knowledge, they started enrolling kids early January, February, once we got the emergency use authorizations for adults. So this study has been going on for about 8-9 months now. So we're anticipating between October and December, just like slowly coming down from the less than 12 years. And like they were saying, 5 to 11 is the next group. So we're hoping October, November we'll get the authorizations. and then a couple of months later for the younger than 5. But by the end of the year, we're hoping, just because we're seeing an increase hospitalizations, severity of disease, even in kids with the Delta variant. And then there are other variants that they're keeping an eye on, but they haven't spread across the US at this time. So we're just kind of going by the information we have. Yeah, but they did a fantastic job and I'm super proud.
Thank you so much.
I did want to mention, for anyone who doesn't have access to transportation, I believe Uber is doing a free ride service to a vaccination site if transportation is not an availability to you. So it's a great opportunity to get to a vaccination site and then back home and get your COVID shot.
Yeah, thank you for.
I think there's also a Medicaid transportation service on the DC COVID website with numbers to call for those who don't have Uber or smartphones. There's resources out there, but yeah, that's really great. Thank you so much, Christian.
Right, and that's an excellent point. I do work for the DC Medicaid program, pharmacy director, and a transportation benefit is one of the things that are offered to Medicaid recipients, whether they are in straight Medicaid or any of the Medicaid managed care plans. So they simply have to call the transportation broker to arrange an appointment. And Medicaid also has contracts with Uber and Lyft. So it would not necessarily be on a van with other people. You could get an individualized transportation trip to and from a vaccination site. Thank you for that.
That's great. Thank you so much.
I had a quick question for you guys. I got the Johnson & Johnson and didn't have any symptoms afterwards. I was wondering, do you know if the non-mRNA vaccines are going to have any boosters, or has been any talk of that? Or what?
Yeah, so I think that they're working on a possible Johnson & Johnson vaccine like booster or second dose, but my understanding is that it's less like far along, similar to how the Johnson & Johnson vaccine came out after the mRNA vaccines. I think we can expect that, if any boosters or third or second, doses for that would kind of follow a similar trajectory. And yeah, so as far as I'm aware, right now, they're not offering a Johnson & Johnson booster, but that may change. And there's also, the possibility that in non-immunocompromised under 65, they decide that a booster is not necessary at this time because the antibodies and the protection is still strong. So we should be finding out more information about all of these things for that age group in the next probably couple months or so.
Cool, thank you.
Yeah, no problem. Thank you.
Sorry, real quick. I think one other thing that's maybe important to know is that obviously it's never fun to get sick, but actually having side effects after the vaccine is not a bad thing. That, sorry, excuse me, is if anything a good thing. It's a sign that your immune system is working and that your body is working to to fight this sort of, obviously as explained earlier beautifully, not actually the virus itself, but this sort of spike protein that's been developed in the case of the mRNA. So it's really just a sign that it's working. So obviously not fun to be sick, but having some side effects is actually a good thing.
Yeah, that's a good point to make.
Do you want to say anything about how the COVID vaccine, obviously getting a booster shot, that's important and helps us, but what about all these countries that haven't gotten enough vaccine shots, even the first dose, and how important that may be in variants and I don't know, other things that have that
Yeah, absolutely. Yeah, and that's something that we didn't mention, but should definitely emphasize. I think what they are recommending is to get a largest, like the as large as we can population vaccinated before, you know, getting a small population, like multiple vaccinated. And that would be the goal. You know, I personally haven't looked into the kind of international relations aspect when it comes to vaccine availability and distribution to other countries. I know in the United States, you know, the ideal thing would be for everyone who can to get, you know, to get the vaccine, and then, you know, we'd work on some of these boosters, which we you know, it's an ongoing project. But if anyone knows anything about vaccine distribution internationally and could like contribute that, be much appreciated.
Sure, let me jump in there, Grace. So to my understanding, a lot of it, because I've been following vaccine distribution across Europe, but also in the Southeast Asia area, a lot of it does depend on trade agreements and like where the vaccine is being produced, manufactured, the research behind it. So there's like much more complexities that kind of go above like our basic understandings. I think the US has shipped vaccines to other countries. I'm not sure what that distribution is, but I know it is an ongoing process. But again, it goes back to like trade agreements and like much more of an impact than I can understand. But we are trying to do the most because vaccines are being stored here, being wasted here. So how can we limit that wastage is kind of what we're trying to do in terms of raising awareness.
I think also what I was wondering is like, are we going to get to a point where we've gotten COVID under control? Or is this sort of like, we're going to live with COVID from now on because we're not going to be able to get the world immune? Is there any idea of what's happening with that?
I think there are both ways, trains of thought for thinking. At this time, we don't have information just because we are seeing like various variants come through. So the current consensus, at least the majority of healthcare community, is thinking that we'll have some form of it that we're going to live through. But if we're vaccinated enough, if we keep getting like these boosters, we have antibodies, it will, eventually bring down the hospitalization, the severity of the disease, that kind of thing. Just like, how flu has been around for hundreds of years. And now we're just like, we don't see as many unless like, I think a few years ago, we had a really bad strain. But overall, we don't really see a lot of hospitalizations, deaths from the flu. So kind of eventually kind of going down that path.
And to add to that, I'm not sure the exact number, but my understanding is that every year less than 50% of the American population gets the flu vaccine. So if the question is, if we have vaccines, why do we still have the flu? I think a component of that is the lack of high vaccination rates. So for COVID, the more people, I think that's what they're recommending for as a way to hopefully move forward. Has anyone already gotten their flu shot?
I get mine tomorrow.
Okay. I'll get mine this week as well.
And I get one every year. And it's amazing to me that I've spoken with people who said I've never gotten a flu shot and I've never gotten a flu. And then there are other folks said, well, I had the flu once and I'm not going to get a shot. It's just, to me, your explanation of how, the need for an annual flu shot, because the variants think the virus changes, prevalence changes, and just the fact you want to protect yourself and others. I mean, you may not feel sick, but you can still pass the virus or into someone who may not be able to tolerate it, as well as your body. So I think it's part of us being good and responsible neighbors to one another. So it's our mutual pitch for everyone to get your flu shot, to get your COVID shots, and to get the booster when it is right for you to do so.
Thank you so much, Ms. Fairfax. All right.
Thank you, Charlene, for sharing that.
You're
And
welcome.
I re-echo it. Are there any other questions?
All right, I think it might be time to move on with the rest of our Sundays.